I'm Danielle, and I'm going to be showing you a head-to-toe assessment. And so first I will introduce myself to the patient. Hi, I'm Danielle. I'm going to be your nurse taking care of you today.
Okay.
Can you tell me your name?
Chrissy.
Do you know where you're at?
Home.
Do you know what day of the week it is?
Saturday.
And do you know who the president is?
Obama.
Okay, perfect. So first thing I'm going to do is I'm going to check her smell. So I'm going to ask you to close your eyes. And will you include one of your nostrils? Smell this. What do you smell?
Alcohol.
Nice. And occlude, yes, perfect. What does this smell like?
Coconut.
Perfect. Next, I'm going to check, use the smell and eye chart to check her vision, but we have already done that, so we will bypass that and go on to the next. This will be checking the nerves 3, 4, and 6, so I'm going to have her lift her eyebrows up, and then I'm going to do the, not that one, I want this one, so Perla. Okay. Perfect, and now I'm going to check for the red eye reflex. Perfect. And then I'm going to check for the optic disc. Perfect. And then I'm going to do eye motion. So while you're sitting there, keep your head still but follow my finger. Perfect. Okay. Now that we've done that, we're going to check cranial nerve 5 and 7. So we're going to, I'm going to actually back up. There's one more thing I wanted to check with the vision. I want to check her peripheral to see how much she can see. So tell me when you can see my fingers.
Now.
Perfect. Okay, now that we have that done, I will be checking cranial nerve 5 and 7. So if you'll puff your cheeks for me. Perfect. Now if you can open your mouth, close it, clench down. Perfect. Okay, now we smile, frown. Perfect. And then I also want you to wrinkle your forehead. Nice. And then close your eyes. Can you feel this?
Yes. Yes. Yes.
Perfect. Okay. I also, on this, want to check some senses. So if you'll close your eyes for me. Is this dull or sharp?
Dull. Sharp. Dull. Sharp.
And look down here.
Dull. Sharp. Sharp. Dull.
Perfect. Okay, moving on. Cranial nerve number 8. We're going to try the Rhine test, Weber test, and we'll also doing this, we're checking for her hearing. So I'm going to borrow my tuning fork and have you close your eyes. Can you feel this on both sides?
Yes.
Perfect. All right, now tell me if what's louder, this or this?
This.
So air, and then we'll do same thing on this side, conduction or air?
Air.
Perfect. Moving on, cranial nerve 9, 10, and 12. I'm going to have her stick out her tongue. Perfect. Wiggle it around. Perfect. And then, let's see. I'm going to check her gag reflex. She's got a good one. Can you say ah?
Ah.
Perfect. And then take a swallow. Beautiful. Okay, next thing I'm going to do is check her mucous membranes. one of these. Perfect. So we'll say ah. Alright, I'm inspecting for any sores, white spots, red spots, anything that looks abnormal. While I have this, I'm going to just take a peek in her ears. Perfect. And then I'm going to just look up your nose. Perfect. It's clean.
Thank you.
Very nice. Alright. Now checking cranial nerve number 11, I'm going to have you shut your shoulders. Perfect. And then I'm going to have you put your, try and push against my hand. Perfect. Next I'm going to do is do a rapid alternating movement, so if you can do that. Alright. And then if you'll stand up and do, close your eyes and put your heel to your knee and rub it down your shin on both. Perfect. And then if you'll put out your arms. Okay. And then if you will walk, so you can open your eyes. And then, so I'm going to have you walk on your tippy toes across the room. Walk back on your heels. And now do heel to toe. Perfect. And then if you'll stand back, close your eyes, and then bounce on one leg, bounce on the other leg. Okay, perfect. So now I'm going to have you just go ahead and sit back down and close your eyes. All right, can you tell me what this is?
Paperclip.
Perfect. And then can you tell me what I'm drawing in your hand?
A circle.
Perfect. Okay, next thing I'm going to do is inspect. So while I'm doing this assessment, I've been inspecting her skin, and I've been making sure that there's no sores, no rashes, bumps, anything that would look abnormal. And while I'm assessing her skin, I'm also going to be checking for edema. I want to make sure that there's no swollen anything, just making sure that she looks okay. Next, I'm going to check hair. So I'm going to inspect her hairline. While I'm doing this, I'm going to be palpating and checking all over. I'm checking for any dryness, any bumps on her scalp, lice, and she is good. So moving on. And I am going to assess her neck and throat now. So I'm looking for symmetry, and it's perfectly symmetrical. And now I'm going to palpate her lymph nodes and making sure. Perfect. And then also I'm going to feel her thyroid. So while I'm feeling for her thyroid, I'm just going to have her take a sip of water and swallow for me. Oh, perfect. Okay, and then I'm also going to check her carotid. So. Okay. While I'm doing the pulses, I'm just going to grab all of them. Nice, equally and strong on all of them. I'm going to use my bell and listen for any bruits on her carotid. Bruits. By bruits, I meant bruies. Perfect. Making sure that I only listen to them one at a time. Otherwise, we'll have her passing out, and that would not be a good sign. So next I'm going to listen. I'll grab my stethoscope. I'm going to listen to her back. I'm going to palpate. We say ABC.
ABC. ABC. ABC.
Perfect. And now tell me if you feel anything painful.
No.
I'm checking for the CVA tenderness right there. That would indicate kidney problems. All right, now that I'm going to listen, I want you to say 99.
99. 99. 99, 99, 99, 99.
And then again with saying E.
E, 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 E.
And whisper 1, 2, 3. Okay, perfect. Now that I have that, I'm going to listen to the front. I'm going to auscultate for breath sounds. Perfect, nice and clear. I am now going to listen to her heart sounds. So I'm listening to the aortic. I lied, the aortic, pulmonic, herbs, tricuspid, and mitral. Very nice. Okay, next thing I'm going to have you do is lie down. If you'll lie down on your left side for me, I'm going to re-listen to those 5 parts again. So again, aortic, pulmonic, herbs, tricuspid, and mitral. Very good. All right, you can lay normal now. So next thing I'm going to, I should just keep this over here. Okay, next thing I'm going to do is I'm going to inspect her abdomen. So I'm checking for any bumps, bruises, anything that looks abnormal. And then after that, I'm going to auscultate and listen to bowel sounds. Okay, perfect. And now that I've done that, I'm going to percuss. Okay, now that I've percussed, I'm going to palpate. So I'm going to use light palpation. Do you feel any tenderness?
No.
Okay. And then I'm going to do some deep palpation. Perfect. Okay, while I'm down here, I'm going to listen to her aortic. Abdominal aortic. Whatever. Okay, perfect. And then I'm going to feel for her liver and her spleen. Deep breath. Alright, deep breath. Perfect. Okay, moving on. I'm going to check for her cap refill and for her strength and Homan sign. So you can go ahead and sit up for me if you'd like. Okay, so let's check her cap refill. Perfect. Less than 3 seconds, just the way we like it. Your feet are a little cold, but that's okay. Cap refill's still great. And then go ahead and squeeze my fingers. Perfect, and then push against me. Push against me. Perfect. And then, does this hurt?
No.
Okay, does this hurt?
No.
All right, and now I'm going to check for her reflexes. This is what I want. Okay, so look away. You ready? Okay, that was very strong. Okay, here's another one. Very good. Another one. And another one. Go ahead and relax. And then one more. Let's try that again. Nope, that's why it's not working. Let's try that again. And one more. Make sure that you do it in the back of the heel, otherwise it won't work. And that is is my assessment.